Let's have a chat with Mark, who joins us. Now, Mark, let's talk about booster jabs, because although many of our viewers have had 2 jabs, the booster is proving, as we know, more problematic, isn't it?
It is. It's interesting to see that figure in mid-Sussex. Some speculation that was a very enthusiastic area taking up the 2 jabs, but had they had problems getting the booster, is the effect of it beginning to wear off? There are clearly problems with the booster jabs. So, for example, the NHS national website doesn't get updated regularly enough with local offers of the booster jab. It offers to send you a long way away. Your GP may not be offering you the booster jab because they're trying to get back to normal service and they're not doing the booster jab. And the sheer pace of the rollout is quite challenging for the NHS nationally and locally. But locally, senior doctors are telling us they are doing all they can to make the booster jab as easily available as possible.
We're adding venues and planning venues constantly across the whole of Kent and Medway. We're also planning some pop-up clinics in the future. So certainly in the Tonbridge area, there's from early next year, we'll be having another venue there for people to attend. So we are working on increasing the capacity constantly.
Now, Mark, last night we were talking about how exhausted many frontline NHS staff are after the last 20 months, and you got more on that this evening.
Yeah, indeed. So all this week I've been looking at some of the pressure points in the NHS in Sussex. On Monday we did community services, GPs yesterday, but today we've been looking at how the NHS recognise their own staff are under pressure with their mental health, and the Mental Health Trust is running a very interesting scheme to give them support as quickly as possible when they really need it, and I've been to see how that's been working. NHS staff have worked tirelessly during the pandemic, but I frequently hear they're exhausted, broken and need support. The Sussex Mental Health Trust has recognised that and set up an online support scheme for authority social care staff and NHS employees. It's already helped more than 1,000 people.
Staff members have been coming to us with, yes, as you said, stress, burnout, issues to do with, with being supported at work as well. If people have had bereavement and they're constantly around, seeing death, this brings up all the emotions, which then, needs being supported.
So everything is obviously being done online. So we're going to interview people online as well. And I have with me Kat. Kat, just tell me why you feel the scheme is necessary.
Obviously, we're hearing firsthand from staff how they are finding it working in NHS and social care services at the moment, and the pressure is immense and it is affecting staff. I think this service, alongside other things that are going on, is incredibly important. Having to witness people struggling with COVID has been quite traumatic for staff, and it's something that they need support with as well.
So let's have a chat to somebody who's actually used the service. Alexius, you're with us. How useful was it for you to have this service to hand when you needed it?
Hi, I found it incredibly useful, actually. You can't really understate how much stress we've been under and how difficult the work has actually become. And then also managing a lot of the kind of mental health difficulties that have kind of arisen due to COVID. It's been very challenging, which again is why it's nice to have a service that you can access as and when you need, really, if you need to talk.
Since the start of the pandemic, we've heard of the need to protect the NHS. This scheme takes it a step further and looks to protect the staff the health service need to look after us, the patients. So clearly tonight we're talking about a whole range of challenges for the NHS, from CCAM right through to ordinary staff struggling with their mental health. It's not going to get any easier. Tomorrow I'm going to be looking at the situation and the pressure in both hospitals and the ambulance service, Natalie.
Well, thank goodness you're here to talk us through, Mark. Thank you.